Hello and welcome back to the New School OBGYN podcast, a podcast in women's health but for everyone. Our goal is to promote good and reliable knowledge because the source of your information matters. My name is Eric Schmit. I'm a board-certified OBGYN, and today I have with me Ms. Rebecca Fansler.
Hi.
Welcome back.
Thank you.
Please consider downloading and following along. We're on all the major podcast hosts, and check us out on YouTube for the video podcast. Today, as I adjust my posture, we're going to be talking about low back pain in pregnancy, and also I'm in my Seattle Sunday best.
Looks great.
As you can see. Thank you. But go ahead, Rebecca, give us a little bit again about yourself and what we'll be talking about today.
Yeah, of course. So I'm a certified personal trainer with an additional certification in pre and postnatal exercise. I also have bachelor's degrees in biomedical sciences and psychology and a master's in regulatory science. Today we're going to be talking about low back pain, as you stated, its origins and how to reduce and prevent it, and when it's important to seek medical attention. And honestly, this is just a really great podcast for anyone that's experiencing back pain.
Mm-hmm. Now, low back pain and pelvic pain is probably something I talk about every day, multiple times per day. The prevalence in pregnancy, as far as the statistics go, is about 60 to 70% of all pregnancies at any point in the pregnancy. But it's probably a little bit low as far as the everyday practice. And so tell us kind of what causes low back pain.
Yeah. Before we get into low back pain in pregnancy specifically, I want to take a second to talk about why our muscles get sore in general. And this can be for a variety of reasons. We're not going to talk about why they would get sore if it's related to sickness, so just keep that in mind. But our muscles can get sore from the damage that occurs during exercise. This is normal. It's actually needed for muscle growth. The repair process is what helps us build those stronger muscles. You can also experience soreness due to recruitment of new muscles, inflammation from overuse, and then sometimes if neighboring muscles are tight, it can create tension. So for example, if we're experiencing low back pain, it could be a result of really tight hamstrings. So stick with me for a second. Our hamstrings attach to areas on our pubic bone. If you're curious, it attaches specifically to our ischial tuberosities. And when those muscles, the hamstrings, get really tight, they can cause our pelvis to actually tilt backwards, and that's what's causing the low back pain. Now we can cycle back to low back pain in pregnancy. In the early part of the pregnancy, typically the first trimester, our body is starting to produce more amounts of progesterone and relaxin. This is allowing the water content in our collagen fibers and our ligaments to increase in elasticity. And so that is allowing for more movement of our bony structures, and it's actually reducing our joint stability, and that's contributing to our alignment changes. And this is of particular note in the pelvic area.
Yeah, and these early changes, while it's the first trimester, maybe early second trimester, not the time where we see most of the complaints of low back pain, but definitely those changes are starting to happen with those increased laxity in the pelvic bones and the low back, and the movement of those joints, which causes inflammation and therefore pain. So yeah, definitely something that can happen earlier on for some people. And so, yeah, we'll just go on to a little later in the pregnancy, and then we'll talk more clinically.
Mm-hmm. So around the second trimester, there's an increase in the estrogen levels in the body, and that's helping to stimulate milk duct development. And so this development naturally increases the size and the weight of the breasts, and this can cause some of the first...
Sometimes up to 3 to 4 pounds.
That's just so much additional weight on the chest. And because of that change in weight, you might actually start to notice some changes to your posture and your spinal alignment. Most commonly, you're seeing a change in the curvature of the upper back. And you can start to actually develop rounded or hunched shoulders if you're not used to carrying that amount of weight on your chest. So you're pulling forward. And As the pregnancy continues, baby's growing, uterus is growing, belly's growing. Yay, super exciting. But that's also going to cause a shift in your center of gravity as more weight is starting to protrude out in front of you, and your core muscles are starting to shift out of alignment just to compensate for that change. And so now you're getting this really fun pairing of baby's weight plus our weakening core muscles. And that can allow for your lumbar spine, or the lower part of your spine, to pull forward. And so this is where we can begin to develop an anterior pelvic tilt, or a forward tilt of the pelvis.
And every day we see these as, somebody probably later on in the pregnancy is definitely arching back, shifting their weight back to try and compensate for that additional weight that's usually on the anterior or the front surface, or the front area of mom.
Yeah, and so that's taking you out of your proper spinal alignment, and it's actually loading your muscles improperly, and it can cause a lot of discomfort. And so it's really important to try and do as much stretching as you can to help open up a tightened chest from rounding forward, lengthening out those hamstrings and the hips to combat any lower back pain that you might be experiencing. But second trimester, third trimester, you're just getting all sorts of flavors of back pain. It's low, it's middle, it's upper, it's everywhere. But all of those changes that we've just talked about can contribute to the development and the exacerbation of back pain. But here's the good news. There's a lot of things that you can do to help prevent, help alleviate. It just kind of depends on where this episode might be catching you in your pregnancy. And a lot of these things that we're going to talk about, you can do in the comfort of your own home. A good strength and stretching routine can help prepare your body for the changes and the physical stress of pregnancy by helping you to maintain proper posture. I see you're shifting to adjust your posture. It helps to strengthen your muscles, reduce muscular tension, and also increase your flexibility. One of the things that I kind of live and breathe by is a strong core and strong glutes equals a healthy back.
So why the core and glutes?
So those are fantastic stability muscles that we use every single day. If they are strong, you've got a strong foundation. It's going to help lock you into a proper posture. You may not even realize it, but they're there. They're working really hard.
Mm-hmm. All right. So that was a detailed overview of the different causes, both posturally and kind of on a molecular standpoint of low back pain in pregnancy. Clinically, like I said, we see this every day, and we try to combat it every day. But whether it's again most commonly coming in the later trimesters, often patients asking me what they can do about it, and or what's causing it. And so, first thing you want to make sure is that there's nothing alarming going on, or you need to call and seek medical attention sooner.
But when do you know?
Those would be, thank you. Those would be, more severe pain. Often, if it's low back pain, musculoskeletal, it's going to hurt with movement, or different postures or different positions that you're sitting in, and you can probably get relief in a different position or by taking it easier. But if that pain is not going away with changes, then contact your provider or come in sooner to seek medical attention. Sometimes if there can be potential neurologic deficits, and whether or not that's some sensation changes, or you don't feel things like you normally would in the legs, or you can't move your legs, that's something definitely come in sooner. There can even be moments of sudden incontinence or losing urine or fecal incontinence. While incontinence can be quite a common thing, or stress incontinence in pregnancy with the growing pregnancy and pressure on your bladder, those could be potential warning signs if you're losing your whole bladder. Or if there's any, severe headaches, fevers, yes, sooner medical attention. But yeah, once you kind of confirm that it's musculoskeletal pain, there are a number of things that we can do. I think one of the big hallmarks of all this is prevention.
Yep.
And so even before the pregnancy, whether it to be planned or not, having good, strong glutes and core, and stretch it routines and things like that,
Makes a world of
good.
difference. Yeah.
Yes. And then, as early pregnancy, again, continue to work on that because it's safe to do throughout, as we talked about in the first episode, with exercise in pregnancy. Yeah, and then there's a bunch of other non-exercise related things which you can do.
Yeah.
And go ahead, Becky, with letting us know what we can do.
Yeah, so if exercise isn't your thing, or you're looking to complement your exercise routine, just all-encompassing, you start with mindful movements. And so what does that mean? Moving with intention. If I were to drop something on the floor, a mindful movement to pick that up would be to squat down instead of hinging and bending at the hips. It's much better for our back. It engages those glutes and our core. You can also do a full body turn instead of just a rotation to grab something. Shoes are huge. Having shoe inserts for better support, more cushioning, can really help with a lot of the pain that we might feel in our low back as a result of what's going on at our base. A wider toe box is also great, especially if you are starting to have some swelling in the feet. You could even go no shoes while you're in the house. It's great. A note, if you wear high heels, be careful with this. It can actually shorten your calf muscles and contribute to an increase in back pain. Standing. Sitting can shorten your hamstrings if it's done over a prolonged period of time. So making an effort to stand and walk around, stretch out those legs at least once every hour, just 5-10 minutes if you can. It's really going to make a big difference. You can do prenatal massage or a warm bath. Warm, not hot. My favorite trick for low back pain or even tight hamstrings, sometimes any muscular pain, is using a compress or a heat pack. And if you don't have one of those handy, you can actually make one of your own. This is something I did in my childhood, and it's kind of carried with me. You can actually fill like a sock or a pillowcase or whatever type of like cloth material you want with a cup or two of uncooked rice. You heat it in the microwave after you tie off whatever you've got your rice in for like 30 to 60 seconds, just depending on how hot you want it to be. And then you put it on the area where you're experiencing some soreness, and it works really well. It sounds weird, but it's a great little trick.
Used it for my hamstring not too long ago.
And it worked, did it not?
Now my calf hurts.
Well, we can work on that. But that's not a result of the rice.
No.
Don't blame the rice. Proper posture. This sounds really silly, but it's huge. A lot of people have terrible posture. They don't know how to sit properly or stand properly. And so sitting, couple key points. So you want to sit with a neutral pelvis. And this means you want to sit on your actual sits bones and not your sacrum. So those sits bones are the little bony prominences that you feel kind of in your bottom. Your sacrum is what you would know as your tailbone. So we want to sit nice and tall, not slouching. Slouching is going to put us more of a sitting on your sacrum with like a rounded tailbone. You can also have a good lumbar support for your chair. It doesn't have to be anything specifically marketed as a lumbar support. You can just use like a little throw pillow, a rolled up blanket, just something to stick behind your lower back as you're sitting. It helps just kind of keep you in that nice upright position. You can also use a footrest under your desk if you have a desk job or you just find yourself sitting a lot. If you are vertically challenged like I am, it makes a really big difference having something to rest your feet on comfortably. Belly bands, fantastic support. As belly gets bigger, you want to have something that supports it and helps redistribute the weight of the belly. You can
kind of nicely, especially later on, late second, third trimester, helps to get that weight more centered. So, the versus, and also potentially get baby off your pubic bone, because both those things can be
Sounds
quite uncomfortable.
painful.
Yeah, I wouldn't know, but I see it every day.
Anecdotal. You can also invest in a supportive sleep or breastfeeding pillow. It's going to help maximize that proper posture and give you support when you need it most, but may not realize it. And if none of these options are helping with your pain, reach out to your doctor and see what they can do to help you figure out what's going on.
Yeah. And again, if it continues, there's a number of different things and kind of the things that we can try for the low back pain. We talked about a lot of these options, but and we'll go over some stretches here in a moment. But often, if it's refractory to or not responding to any of these treatments, we can send to physical therapy for someone to have more maybe directed diagnosis and treatment routines for what specifically is going on, and also chiropractic work, massage we talked about, also acupuncture could have relief for somebody. So there's a bunch of different things we can do, and then there's medications, and there's never going to be a perfect fix with a medication. Unfortunately, hands are tied with medications in pregnancy. Obviously, we want to avoid any NSAIDs. There could be some exceptions to that rule, but the general rule is, avoid NSAIDs in pregnancy, or that's like ibuprofen, Advil, naproxen, Tylenol, is something you can take, but it's honestly not going to do that much. And there's also medications like muscle relaxant medications, again, that could give some relief, specifically, maybe more so at night, because they might make you sleepy. And so, well, for the next part, we do want to go over some stretches, because Becky is an excellent stretcher and I am not. And so what I'm going to do, Becky's going to talk through it, and obviously you can listen to it on the podcast, but if you want to hopefully see some of these actual stretches to go through it, we're going to edit that in on the video podcast, and we'll test my editing skills with that. So, all right, Becky, go give us at least a few stretches that might help us with low back pain.
Yeah, so I picked out 4 of my favorite back stretches. Before we get into this, I just want to give a reminder that it is really important to breathe properly with your movements. It helps to coordinate the muscles of the pelvic floor. We will have an episode on the pelvic floor coming soon. It's a really, really important talk that we'll have. So we're going to start with downward facing dog. This is a pretty popular, very common stretch. It's great for all levels. So our focus for this stretch will be on the low back, our hamstrings, and our calves. We're going to start on all 4s. Hands will be shoulder width apart, and feet will be hips width apart. If you are in second or third trimester, you might want to widen those feet out a little bit more just for a better supported base. So on an exhale, we're going to lift our hips up to the sky, straighten out our arms and legs, maintaining soft elbows and knees. And for an extra stretch, we can pedal out those feet. It's going to give us a really big calf stretch. You can cycle through this movement as many or as few times as you like. In our next stretch, this is going to be cat-cow. Our focus will be on the low back and abdominal stretch of the transverse abdominis and the erector spinae, which are muscles along the spine. So we're going to start on all 4s in a tabletop position. On our inhale, we're going to look up, arch our back. On the exhale, we'll look down and round the back. Inhale, look up, arch the back. Exhale, look down and round the back. Next, we'll move on to the standing lateral C stretch. This is one of my absolute favorites. I do this every morning. The focus will be on the latissimus dorsi, the really big muscles in the back, our intercostals, which are the muscles in between our ribs, and the obliques, which are our side abdominals. So we'll be standing with our feet at hips width distance apart. We're going to sweep our arms up overhead, interlace our fingers, and turn our palms up towards the sky. On our inhale, we'll lengthen through the spine and reach our hands up. On the exhale, we'll reach off to one side, creating a C shape with our body facing towards the wall. The next inhale, again, we'll lengthen through the spine and reach the hands up into the sky. On our exhale, we'll reach off towards the opposite side, again creating that C shape with our body pulling towards the wall. In our final pose, we're going to do child's pose, another favorite. Focus will be on our low back and our hips. We're going to begin on our hands and knees. Knees will be wider than hips. On the exhale, we're going to bring our hips back towards our heels, and you can reach your hands either behind you alongside your feet or out in front of you. Our forehead will rest on a mat or a bolster, a pillow, a folded blanket, whatever is comfy and available. The belly will hover above the mat. And you can hang out in this pose for as long as you like. If you need any adjustments, modifications, you can bring your knees out a little bit wider to make space for baby. You can support your ankles by tucking a blanket under them. It can be kind of uncomfortable having those ankles pressed into the mat. And you can support your forearms on a bolster or some pillows if you need additional room for belly. And those are the 4 stretches we've got.
Perfect. Well, that brings us to the end of the podcast. And thank you for everybody for listening and viewing. If you have any questions, please let us know in the YouTube comments. As always, the content of this podcast and video are for educational purposes only. None of the content is meant for personal medical advice. Contact your provider if you are needed for personal medical advice.
And if this is your first listen, go check out our first episode where Dr. Eric and I chat about the benefits of exercise during pregnancy. And again, you can also check out the YouTube channel for videos that help demonstrate stretches. We've got another video out there on low back pain, just some quick little stretches.
All right. Thank you. Have a good day.